Hello, my name is Jeremy Zwannenberg, and this is in part my story. I've been, at varying times in my life, a child with unmedicated ADHD, a child with improperly medicated ADHD, an adult with unmedicated ADHD, and an adult with properly medicated ADHD, which is where I've arrived at now. This video is partly to explain what it's like to be in each of those varying states, as best I can remember, and partly in support of the chemical medication of ADHD in both adults and children. I can attest to you that my quality of life has been very much improved since discovering the correct type and dosage of medication, and that I really, really wish that I hadn't had so cavalier an attitude towards remaining unmedicated when I was younger. I have a feeling that my life may have progressed a lot more quickly had I taken the steps that had I taken steps to improve my situation rather than simply live with it. Well, where to begin? That's probably a question I should have asked myself before I started making this video, but I guess flying by the seat of one's pants is not such a bad thing. Let's start at the beginning. A child with unmedicated ADHD. Tough place to be. Beyond the obvious signs of being hyperactive, restless, prone to interruptions, impatience, low tolerance for repetition, among many other things. There's a strong sense of alienation that comes with having unmedicated ADHD. You're treated differently. I can recall. There's always somebody telling you to slow down, stop what you're doing, pay attention, and it's not that you don't want to. No, far from it. I would have loved to be able to sit down and pay attention, but it was beyond me. And a child with undiagnosed ADHD in particular will feel this profound frustration because it really is not within their capacity to sit and pay attention and do all these seemingly minor tasks that come so naturally to everyone else. And the anger that is what I remember most of all, being so angry at these people who treated me like I was lazy and stupid and worthless because I couldn't sit still. They treated me like I was some sort of juvenile delinquent, and I remember feeling very, very resentful towards many teachers and other authority figures for their treatment of me. And that is what most strongly springs to memory when I try and think about what it was like to be a child with unmedicated ADHD. And now, I was diagnosed at the age of 9, and as an aside here, I'd like to go ahead and just say that there is a problem, I believe, especially in North America, with overdiagnosis of ADHD. It seems to be too readily thought of as being present. Just because a kid can't sit still sometimes, or occasionally has difficulty concentrating or listening to directions, that does not necessarily indicate a case of ADHD. I mean, to know for sure, you really would need to look at a brain scan, like a magnetic resonance imaging or MRI. There are marked differences in the brain chemistry of individuals with ADHD and those without. However, that's not necessary for diagnosis. However, just because, for example, a teacher, daycare worker, coach, parent of a friend, anybody, just because somebody says to you, I think that little Johnny might have ADHD, that means nothing. That means absolutely nothing, and frankly, it is bothersome when I hear this sort of thing being tossed around all the time. Just because a kid has an occasional, need to run around and shout at the top of their lungs, that makes them a kid. It doesn't mean they have ADHD. Diagnosis of ADHD is made by a psychiatrist after extensive interviewing and testing, and not before, or by anybody else. End point. So, going back to what we were saying before, I was diagnosed at the age of 9, after extensive interviews and testing with a psychiatrist, and I was prescribed the medication Ritalin. Chemical name is methylphenidate, and my dosage was, I don't recall, but anyway, that's not important. Meaningless minutiae. Excuse me. The immediate effects of being on Ritalin were, I could all of a sudden sit still and concentrate and retain information more efficiently, and everyone presumed that since these problems were being alleviated, that the medication was working. So they, aside from adjusting the dosage for my increasing body weight as I grew up, the possibility of different medication wasn't really reviewed at any point that I can recall. Now, the problem with this was, because I did state before that I was improperly medicated as a child, was that Ritalin was not the right kind of medication for me. There were many unpleasant side effects, and these, from what I understand, are what stands in the way of a lot of people wanting to medicate themselves or their children for ADHD, because they're afraid that they're going to turn them into zombies. And frankly, a zombie is how I felt when I was on the incorrect type of medication. I could listen and pay attention and sit still, but I couldn't do things like hold conversations or enjoy a meal. I had this constant dry mouth and sweaty palms, sickly feeling in my stomach, and just imaginative tasks and what's the word for I'm looking for here? And simple interaction, conversation became very, very difficult. I remember feeling annoyed when people would talk to me, just like, "Hi, Jeremy, how you doing?" And I would just sort of like, go away. I couldn't respond. It's like the drug took away my ability to have a human conversation, and it was very disconcerting. As I grew older, I started skipping doses, sometimes for a day, sometimes for a whole week. I started just becoming very off and on with the pills, and even in the cases where one is correctly medicated, going off and on is a very bad idea. All the psychiatric research that I've encountered and that has been explained to me through my personal psychiatrist indicates that the best course of action when medicating ADHD is consistency. It has to be all the time. It has to be, like, you can't do it for school and then, stop in the evenings and on weekends. It doesn't work like that. The beneficial and therapeutic effects of medicating ADHD really only come into play if you are on it consistently and constantly. So that is that's something to watch out for. Now, I can recall actually just totally doing away with the medication around the age of 17 or 18. My usage had grown so spotty and irregular, however, that functionally I would say from 15 onwards I wasn't really medicated. I mean, I continued to give the impression that I was medicated because I was afraid of the reaction of my parents if I were to tell them, I'm not taking this anymore. And because, once again, everybody seemed to think that it was working because it alleviated these problems caused by ADHD, but it introduced new problems, and I was never really successful in communicating just how distressing and unpleasant these side effects were for me. For me, I would have much rather just been, be unable to concentrate or remember or sit still than feel like that all the time. It was horrible. So I just gave it up. I stopped taking it. I stopped seeing psychiatrists. I just decided, the hell with this. I am going to forge ahead on my own, and I am going to conquer this disorder and just make the best of it. And arguably, I guess I did okay, given the circumstances. I graduated high school. I had an 88% transcript average. I went to university. I got into the foundation year program at King's College, and my GPA for my first year was 3.5. For my second year, it was up to 3.8. I developed numerous coping strategies during this time without medication. One of which was writing down everything that my professors would say in university. I took on average 3,000 to 5,000 words of notes per 2-hour lecture in the foundation year program. I can recall actually a printed out version of my notes making the rounds among the other students of that year, but that's sort of an aside, and not at all related to this. Anyway, that was one of the more effective coping strategies that I developed. There were others. I can't recall any really good ones right now, but this brings me to one of the biggest arguments that I have in support of medicating ADHD patients, whether they be adults or children. I do not have a statistic or a source to quote for you, but according to my psychiatrist, my personal experience, my personal knowledge of other individuals with ADHD, and statistical research that I have done in the past, an overwhelmingly large percentage of young adults and adults who have unmedicated ADHD, diagnosed or not, self-medicate. And the 3 most common choices of substance to self-medicate with are alcohol, caffeine, and marijuana. I can tell you that personally I used all 3 to great excess. Marijuana and caffeine more so than alcohol, but I consumed all 3 in frankly ludicrous amounts. I have only recently managed to get rid of the whole marijuana deal. In fact, up until recently, I was smoking about 5 grams of marijuana a day when I could afford it. And for those of you unfamiliar with the drug, 5 grams a day is about $40 at local street prices. And if the whole one joint has as much tar as a pack of cigarettes thing is true, then I was smoking about 10 packs of cigarettes a day. And as one can well imagine, that is not good. Not good at all. Especially since, although it does sort of make the more overt symptoms of ADHD less obvious, i.e. Somebody who's stoned out of their gourd is going to be, able to sit still, for one. He's going to be calmer. He's going to look like he's better able to focus, But in reality, at the same time, it impairs the memory, it makes it more difficult to retain information. It also makes it more difficult to actually follow a train of thought. What it makes you really good at is spacing out and just not taking anything in. The expression in one ear and out the other is perfect in that situation.